Pediatric psoriasis needs to be treated very carefully, cautiously, and methodically. The most important rule when treating pediatric psoriasis is do no harm. Because when you start to intervene too aggressively, so to speak, with psoriasis, it can react differently. That's why you need to be very gentle, and for children it's advisable to change the treatment combinations or even the medications every 3 months, of course, only if the psoriasis doesn't go away within those 3 months. As for general treatment, this includes desensitizing therapy and calcium gluconate. Again, a 5% of calcium chloride solution is prescribed, and the oral form is 10%. Usually this is given for 5 to 7 days. Antihistamine therapy includes the pediatric forms of suprastin, fencarol, or zaditan. This is typically for up to 10 days. It's not recommended to use them for longer because the body develops a tolerance anyway. Or if we see that the itching is intense, we switch these medications. First, one medication is given for 10 days, then another medication is used. 20 days in total is sufficient. As for sedatives, only natural sedatives are prescribed. These are valerian or motherwort. Heel preparations can also be given, such as Nurexant. Again, these should be dosed very carefully, depending on the age. As for vitamin therapy, here vitamin A in an oil solution is used, put it on bread, black bread. This works very well over the course of 2 weeks. This is a general treatment approach. Regarding topical therapy. For the hands and feet, it is helpful to apply dressings with salicylic, sulfur, and tar ointment, or with a 0.5% solution of prednisolone ointment. Moreover, such dressing should be applied at night. While the activity level, so to speak, is lower during this time, the child is resting and calmly, not touching anything. So we wrap this with cellophane and then bandage it to make sure the cellophane stays in place and doesn't come off the skin. And under the influence of these healing effects, the plaques soften and gradually fall off. As for the pustular form of psoriasis, that is the one with pustules, in this case you can't do without a corticosteroid ointment. It is recommended to use Celestoderm with garamycin. This also produces a very good effect. All hormonal ointments are prescribed for a short period. About 7 days is sufficient. Sedative baths are also recommended. Baths with paraffin, baths with Succession and with Celandine. And most importantly, moisturizing the skin. Creams and baths with the addition of emollients. Again, herbs are steamed. Decoctions as well. Sage works well, as does Succession. That's it. And for effective treatment in children, in order for psoriasis to go away and not recur, it is absolutely necessary to sanitize the oral cavity, because in children, as a rule, the trigger for the development of the disease is also tooth decay.